Welcome to a course on global health in the 21st century. This course is for everyone from everywhere because the business of global health affects everybody. In our interconnected world, our personal chances to stay well and healthy are shaped by decisions made globally. If you are concerned about questions of fairness and dignity and how they affect health, and if you have interest in not just reacting to the world as it is, but in shaping the world we deserve, then this course is for you. We will start our learning journey by examining the phenomenon of globalization. This is perhaps the defining feature of the age we live in. We will ask how the global health concept has evolved in the context of the positive and negative aspects of globalization. We will also make explicit the moral and ethical values that underpin diverse opinions, including the human rights approach to health. The global burden of disease and the social and economic determinants of health will be considered next, to help us better understand the how and why of health inequalities. Are global health inequalities improving or worsening? Anyway, does that matter? That will set the stage for discussing the newly agreed Agenda 2030 for Sustainable Development. What is the specific role of health in it? Is this just old wine in new bottles or a new way of doing business? Does Agenda 2030 have the potential to transform the health and well-being of the poorest on the planet? Towards the halfway stage of the course, we will delve into the details of universal health coverage. This is a centerpiece for the delivery of health for all everywhere. We will critically review the feasibility of this grand ambition and what is necessary to realize it. In particular, we will examine the movement of capital and the movement of people across the world, which are the hallmarks of the globalization phenomenon. These drive the ability of national health authorities to protect and promote the health of their own publics. But the global externalities that shape national health policies will be the subject of our next topic. This is about how world laws push us along healthy directions, or at least help to protect us from certain transmissible diseases or from our own damaging lifestyle choices. What would be the implications of going further down that track? We also introduce here the contentious notion of global health security driven by the fears of pandemics such as Ebola. Is the global health security agenda a collective good or selfish self-interest? That will take us conveniently into the expanding realm of humanitarian crisis. We will learn that crises from disasters and conflicts are the new normal for 1 billion people around the world. Health is always among the top concerns of crisis-affected populations. And despite the synergies between health and humanitarian values, we must ask if the two communities work as well as they could together. What must be done to make sure that crisis-affected people are not left behind in the rollout of universal health coverage? We stay with crisis in the next topic that will focus on violence. We will study the epidemiology and various forms of violence before asking why there appears to be an increase in attacks on health workers and facilities. Conversely, should there be a special role for health professionals in peacemaking and peace building? Does health practice have some special healing potential in our fractured and quarrelsome world? In recent years, there is a growing recognition of violence-related mental trauma and how that perpetuates the cycle of violence. Is this a new area for global health attention? With the key issues now covered, we will be ready to look at the range of institutions and networks to deliver on global health ambitions. The World Health Organization is at the center of the global health architecture. How well is it doing, and how can it do better? What are the strengths and limitations of the many other global health actors, and how can they be held accountable and better governed? In dissecting the workings of the global health system, we appraise the key assumptions and principal frameworks that guide international health cooperation. Is this actually creating a healthier world, or just providing well-paid jobs for international fat cats? We conclude by peeking over the horizon at the future. In many aspects, the future is already with us. Established trends shaping health risks and vulnerabilities include the changing shape and distribution of populations. For example, shifts in fertility and aging, migration, and urbanization. But perhaps the most potent factor is climate and environmental change. How will that change the concepts and frameworks of global health that we have built up over this course? As the changes underway affect our collective health, do we have the will and the means to make the adaptations necessary to sustain or continue to advance the health gains achieved so far? Perhaps we may see a new paradigm emerging that takes us beyond global health. Can we call this planetary health, perhaps? Essential readings will be suggested, as well as additional recommendations to read wider. There are also audio podcasts and videos to watch. There will be a lot of content, knowledge and ideas. But the main factor which marks you out as a master's level student is your own ability to analyze, critique, and apply this knowledge. Questions will be posed for self-reflection. You are also strongly encouraged to use the discussion boards to ask your own questions, comment on issues, and engage with other participants. Don't forget that we have thoughtful people here from all over the world. Thus, your own knowledge and expertise will be our greatest asset. I hope that you will find the course stimulating, challenging, and enjoyable. I very much look forward to our interactions.